Welcome to the Healers Café, conversations on health and healing with Dr. Manon.
So welcome to the Healers Cafe, and today I'm super excited because I have two naturopathic doctors with me, Manon Smith and Charlie Cropley. So I'm going to tell you a little bit about them, and then we're going to get right into discussions that matter. So first about Charlie Cropley. So he has been for 45 years, he's worked intimately with patients suffering from autoimmune conditions and chronic degenerative diseases to skin conditions and acute infections, and pretty well everything in between. And he's been practicing and teaching the art of self-healing, which is actually his life purpose. And he graduated from National College of Naturopathic Medicine in 1979. And therefore, he's been practicing naturopathic as a naturopathic doctor, teacher, and author in the Boulder, Denver area for the last 35 years. Now, Manon Smith is working with him as a mentee relationship, but he is a licensed naturopathic physician who graduated from National University of Natural Medicine in 2017. He also serves as the associate editor of the Naturopathic Doctors News and Review and the Natural Path. He was the founding chairman of a professional nonprofit association for naturopathic revitalization, which is dedicated to providing experiential education opportunities for the naturopathic profession. So, wow, I'm really thrilled to have you both here. And I think I'm going to ask a question that I ask everybody first to start this is, and I'll start with you here, Charlie. What actually brought you into wanting to become a naturopathic doctor, or how did you start this whole healing journey?
It's my destiny, and there was a moment in time when I was given a book in 1969 that was entitled The Mucusless Diet, Healing System, and Rational Fasting by Arnold Ehret. I read that book and saw for the first time that through eating, in this case, that we could both heal disease and prevent disease. And I thought I was captivated by it. And I went on from there to, with other revelations and guidances that led me to become a naturopathic doctor.
Okay, great. And know yourself, what was it? Something personal, something, a belief? What started this whole thing for you?
Well, I chased a girl from Everett, Washington to Eugene, Oregon, and needed a grad school to get into. And so that's kind of the flippant answer. But I've always been a systems thinker. Mm-hmm. I studied critical theory as an emphasis as an undergrad, and was planning on going and getting my PhD in critical theory and literature from the University of Chicago. When I learned about naturopathic medicine and a holistic approach to thinking about our interactions with our environment, our culture, our relationships, how our mind influences, and how our past experience influences our health. And so I really got to thinking about my life's purpose in terms of giving back and helping people learn, and helping people awaken to the truth of themselves and the world. So I looked into it a little further and went back to school and got an entire different degree in order to actually go to medical school. And I've fallen in love with the naturopathic profession, much like one falls in love with their family, or, when they have a child and then they fall in love with their family all over again.
Well,
Yeah, it's been a
incredible.
wonderful ride.
And how is it that you were able to connect? Because my understanding is that you're working together with Charlie. And how did this magical union happen?
Yeah, I could probably I'll answer that, I guess, Charlie. You know, Charlie and I, to me, we have very much of a soulmate relationship. And I feel that Charlie is someone who um, I share the deepest parts of my worldview, my belief system, with my passion for life. And we met doing these experiential retreats in Portland. I was running a nonprofit, and we were interfacing students with elder doctors in order to get more elder wisdom and traditional teachings into the schools in an experiential way. We're doing these retreats outdoor, no electricity over a long weekend. And Charlie was one of the biggest supporters of me during that process, and really took me under his wing and taught me how to not only counsel individuals and showed me the foundation of self-healing, but began a very deep and prolonged kind of experiential tutorial in how to relate to people and how to lead people, how to be a leader in a way that is not aggressive and not violent, and is true to the principles of medicine that we practice. So that's been our relationship for the last 10 years.
I see. Okay, well, and Charlie, maybe if you could expand a little bit on your life's work about self-healing, because I think it's we're in a culture that still believes you go to the doctor and they will fix you, and you abdicate your responsibility. You don't take charge of your health. You don't worry about what goes in and out of your body. And so, for doctors to stand up for self-healing, which is one of my big beliefs as well, I'd love to know more about, your work and what that means.
Thank you. My work began with and continues. The core of my work is my own living of these principles and practices, and it's as I say, it's been my destiny, and out of living it, I was guided to become a naturopathic doctor, and I absolutely loved all that I learned, and beginning as a primary care physician, essentially using naturopathic therapeutics, I began from day one offering classes to my patients, and was always interested, as you are, in we could say the whole person, and I had direct experience myself of the power of eating, the power of movement, the power of my thoughts, right? The power of relating. And this became so clear to me that this I can count on. I'll give you an example. When I was an intern in my third year of naturopathic college, I had a patient with rheumatoid arthritis. And I found myself going through this book looking for how do you cure or treat rheumatoid arthritis. And I went, people have been having rheumatoid arthritis for as long as there have been human beings. And I'm still, we haven't found a way, right, to heal rheumatoid arthritis. And I said, Bosh, I know beyond a doubt what will improve this, right? Through eating and through this person's power to to bring healing to themselves by improving their behaviors. And I have gone forward. I've always needed that confidence, that certainty that what I'm telling you absolutely works, absolutely works. Mm-hmm. And so with that, the combination of the experience from my own life and then the love of teaching this to people and seeing them respond to it and love it and get real results that we could count on, it's grown over 40, 45 years.
So would you agree or disagree with the statement that healing is actually simple?
There's a saying that it's something like this. It's the simplicity on this side, if you would, of doing the work isn't worth anything, right? Seeing the simplicity on the other side of doing the work, right? Like, God, it's so simple. However, as you know, it's complex, and I say that healing ourselves is the most challenging of all challenges that we have, unquestionably the most rewarding of all challenges that we have. And in a sense, it is not the most challenging because the challenge of being sick is horrible, right? The life is far worse than the life of being healthy and living a healthful life and meeting the challenges in ourselves to being able to truly care for ourselves.
Mm-hmm, mm-hmm. Yeah.
Yeah.
No,
I don't for you and me and Node, perhaps, it's simple, right?
Well, I find that often people think that complicated things are necessary, or you need many things or many procedures or instrumentation and many drugs or many, natural things, whatever, but it's many of them.
Yeah.
And
it's very simple. It's very simple that there's an obstacle in front of us, right? The wall is there. Taking down the wall might be very, very difficult and complex, but all that really needs to happen is the wall needs to come down.
Yeah, and I think too, I from both your experiences,
That's all.
That's all. Yes.
That's all. That's all. The wall
Take the wall down and you're going to be healthy.
So let me ask you this, from both, because you both interview people together when they come to see you in the clinic, and you have 3 visits, right, to do this full interview.
Yeah.
So what is it that you do there? And I'm kind of referring to this wall. How do you deal with the wall that looks like it's the encasing in the house and that there's nothing beyond it to the person walking in, right?
Yeah.
So explain a bit your process and how your practice works. Either of you. Mm-hmm.
Totally. Charlie, do you want me to start and then you can kind of
I do. Yes, I do.
Okay. Yeah. This is an awesome question, Manon, and it's something that we have a 3-visit intake sequence. It's very extensive, and part of the reason that we do that is because much of the work that we do, it kind of exists at the edge of what most doctors consider their limit of care. And so there's a lot of information and a lot of diagnostic information that is important to Charlie and I, that a regular doctor, most doctors would not really find relevant. The manner in which people speak, the types of concepts that they bring up in a conversation, how long they speak before resting and allowing additional input, how long they concentrate on a topic, the intensity that they communicate about a topic. But furthermore than that, Charlie and I, our entire practice is rooted in teaching people skillfulness in 4 behaviors: eating, moving, and rest. That's one behavior, how we move and rest our body. And then the last 2 are how we think and how we relate. Now, the eating and the moving and rest are things that generally a naturopathic doctor, most naturopathic doctors see the relevance in. And many people who come to us have been to naturopathic doctors. They've had dietary prescriptions, they've taken supplements to help with their sleep. They know that they should be exercising. But these thinking and relating elements influence the way that we eat and the way that we move, as well as influence directly our symptomatology, right? The pain that we're experiencing, the digestive complaints that we're experiencing. And so we start out talking about these physical things and intertwine kind of a diagnostic evaluation of how thinking and relating influence those things, and then how they stand on their own. And this process it's extensive. It takes time to build a relationship with a patient in order for these things to fully paint the picture of what a patient is experiencing, and also what they need, how exactly their behaviors are injuring them. And then our final visit is a very unique process. It's an entire hour dedicated to a physical exam. And this physical exam is not as much for Charlie and I as it is an experiential process by which a patient begins to understand how sensing their body, how moving their body influences directly the health that they experience. And it's something that most patients come away from with an absolute transformation of how they're looking at their health, how they're looking at their body. And that process is just not something that can be done in a single visit. So that's the origin of the 3 visits.
Wow, it's so exciting. I just, the couple things that I'm really getting from this is, which I am in total agreement, is the doctor-patient relationship, but it's time to reflect on the whole picture, not just the body part, but how everything fits in. But I love at the end, because not only are physical exams not being done on some level, and now that we're in this specialized one body part look of the universe, most doctors, or medical doctors, don't even look at the entire person. And many of the patients I saw, they said, well, when's the last actual physical exam? Oh, they just checked this piece. And it doesn't teach you the connection to your body. And it's funny, because I in my practice, I also did a Bowen therapy, but which I did like a shorter version, just for people to connect to their interoception, how their body feels, that we're actually able to connect to ourselves, because we live in such a disconnected world. So I love this process. This is so exciting. It must be so rewarding. And the thing is, you build a connection then with patients that really end up trusting you, but trusting themselves. That's the, that's brilliant. I've also heard you do clinical intensives. Is that a different process than this interview, or is that something, what is that?
Yeah. So, the clinical intensive process. So something that we have discussed and Charlie's learned over a lifetime of practice is that patients need to be inside of a committed program in order to get the results that they're really looking for. And that it is a model that is very much moving forward and being championed by a lot of doctors. And with this type of training in self-healing, we just find that it's impossible to get the results that we expect if individuals are simply booking an appointment when they are in acute crisis.
Yeah.
And so we take people through our naturopathic health evaluation, which is a 3-sequence visit. And there are assignments and therapies that are intertwined in that process. It's not simply a diagnostic process. So we are giving therapies and different things. And then we discuss what exactly are the behaviors, what exactly are the trainings that someone needs in order to heal. Like, how bad is their eating?
Hi, I'm Dr. Manon Bolliger, and I wanted to take a moment to thank you for watching these podcasts. If you haven't subscribed, please do. Also, feel free to leave comments and like it. This way, more people get to find out about this work and about other choices for health. So I think it's really important that we all share this information. I have a free gift to you. It's a 7-sequence email that has tips for every day, and it's a little insight about how to live your life when it comes to health. And it's very much built on how I managed to overcome stage 4 cancer and what it took. So I would love you to have this, and thank you once again for listening to these podcasts.
Right. You know, many people, every doctor knows that patients have tried numerous diets and have not been successful. They've tried numerous exercise programs and not been successful. And it is not because diet and exercise don't work. That is not what's happening. It's a level of skillfulness. It might be the type of diet. It might be how they're eating. It might be emotional elements surrounding eating. And the same thing with exercise or movement. And so we enroll people into a clinical intensive period, which is an 8 sessions sequence. And it can span between 8 and 16 weeks.
Mm-hmm.
And it is highly personalized. Mm-hmm. Charlie has 45 years of course material that we have to choose from in order to personalize programs. Yeah. And it's pretty radical. The degree of personalization that we're able to facilitate with individuals using modules and videos and assignments and articles, and it's very well packaged and intuitive for people to access and understand. And then Charlie and I are available during one-on-one sessions and check-in calls throughout that period in a very structured way in order to hold that container, but also to ensure that someone is actually getting better. And if they're not, to change their program so that it's emphasizing what they actually need. And that, I think that's what sets Charlie and I and our company is called Nourish, Naturopathic Healing Arts. And it's what sets us apart from other program-based approaches, is that it's not one program.
Right.
It's a program, but it's, if you and your neighbor were to do a program with us, you would likely be getting different material based on what you actually need at that current point in your life.
So it's like the patient journey that you're able to do thanks to the many years of experience and the materials that have been collected to kind of help the patient along, right? So is that's the new business model, or you've always done it this way, or sorry?
No, it's probably Charlie can answer.
Charlie should answer, yeah.
No, I have not always done it this way, and
Okay.
I'm constantly learning and honing my skills as in this case, as a teacher and a doctor. The foundation that we work from is that of relationship, and we begin during the intensive with a teaching on the patient's relationship to their illness, and introduce the naturopathic perspective of illness as a message to us, right? And so we begin to transform their relationship to their illness, and then in the physical exam, we then look at their relationship to their body. And then we look at their relationship to each of the 4 behaviors, to their eating, to their movement, to their thinking, and to their relationships with other people. And we're teaching them that how to, that their body, their mind, they are the only ones who know and receive the messages from their body and their minds.
Yeah.
And the awareness of that is transformative for them. They do see that my ways of eating are harming, they're poisoning my body and stressing my body. And that only I am aware of this. And then they learn the means to make the difficult changes in their ways of eating by a relationship that is founded on kindness and truthfulness. And that is, as they grow in that, they are empowered. They see and experience their own self-healing power. And so that's one of the focuses throughout the intensive.
I feel like we must have been twins. It's like I'm thinking, wow, I think I even have that in my book, what patients don't say if doctors don't ask. It's the mindful doctor-patient relationship. And I'm like, yeah, the patients know the answer. They do.
Yes.
They just that we don't trust what we're hearing from within because we're disconnected. And we have this plethora of, thoughts.
And the sickness is the remedy. Rather than a relationship to our sickness and our symptoms that is to make this go away so they'll feel happy. Right. They learn that they themselves are the medicine and to come closer to it. So, for example, most of us are highly self-critical. And by forming a caring, compassionate relationship with our self-critic, we listen to what we've been afraid to listen to. Right. And in the process, that is how healing happens. Our central message to people is that you yourself are the source of your healing. You are the medicine. Really, really, your presence contains the intelligence and the power to heal. You're very present. Just right? Go be in relationship with your self-critic, and not just go do that. That's the skill that we teach them,
Right.
right?
Yeah.
How to do that.
Yeah.
Yeah.
Wow. We're almost out of time, but I mean, this is such a wonderful share. And is there anything else that you would like to leave either to doctors or healthcare practitioners that, you know, don't know about your work, or to patients that are interested in your work? Because I kind of attract both. So yeah, feel free.
Yeah, I would say that another key piece that we have not discussed is the role of community in our work. And community is one of the primary, perhaps the biggest driver of health, and certainly of behavioral change. That the community, the atmosphere, the culture around us largely dictates our ability to sustain a healthy lifestyle, make healthy choices. And it is an element that we are working tirelessly to launch a community support platform that is not only for our patients, but also will be available to other doctors, other practitioners who would like to use a platform to interface with their clients, with their patients, but also know that their patients are getting support from other people who are learning about self-healing, about self-care practices. This will be a platform where other doctors will have the ability to come on and give tutorials, give trainings, give teachings to their patients and other people's patients, right? So kind of a collective, if you will, platform. So we're working on finding a platform for that. Most of it is built, and we hope to launch it within the next 6 months. It's called Nourish, a community of self-healing.
Wow, that's incredible.
Yeah.
Oh, and it's so needed. It's so timely too. That's really wonderful. And do you have any last words, Charlie, or?
Let's see. I should have.
No, maybe not. There are no shoulds. I think you said it all before. That it was such a strong, powerful thing.
I'm thinking of, and that is when we present the clinical intensive to our patients, we view it and explain it to them that in our reported findings, this is what we see taking place. You have MS. This is the way we see to approach it through these behaviors. And we say to them that this intensive that we're going to do with you is both, it's diagnostic, it's therapeutic, and it's prognostic, meaning this is what we anticipate will happen, but we don't know at this time really how effective these therapies are going to be, how your body's going to respond to them. That's one. And the other that we don't know is how avid of a student you are going to be. And we will learn that over these next 8 to 16 weeks. And then at that point, we will have a much more informed prognosis. If you're 40% better based on what we've done, then our prognosis would say it will probably take this long in going forward. And if you have found yourself challenged in your eating, in your movements, whatever it is, then that then is what is impeding your progress, and that we would recommend this is what we will focus on going forward, because that's revealed itself as necessary for you to attain the healing that you want to attain.
So it's like a ever-evolving prognosis
Yeah.
and diagnosis, for that matter, right? Because nothing seems to be permanent in that way.
I would love to jump in and clarify something, because Charlie and I often talk about this, and there's a gross disservice that a lot of patients have been delivered, this idea that there's a therapy or something that they can do or take, or a process that they're going to heal from chronic degenerative disease relatively quickly. Mm-hmm. And it's not true. It takes years to heal from chronic degenerative disease. Symptoms may abate quickly, but we all too often see people relapse into these disease states very quickly after working with very esteemed holistic doctors who are doing awesome work. But when those foundational elements are not addressed at a foundational level, and somebody's entire life is not changed, they come back. These symptoms come back. The chronic degenerative disease state it's not far away after 3 months, after 6 months. After a year. We have 2 patients that we've been working with for a year now, and they are transformed human beings. We look at them, they are a different person, 100%. They're not the same person without the symptom.
Right.
They're a different person, and they will never get sick in exactly the same way. They will not slip back into their autoimmune disease in the same way again. So I think that just needs to, I wish more patients understood that coming forward or moving forward, because I think it would ameliorate a lot of frustration and annoyance at the lack of progress that happens sometimes, or the plateaus that we hit and then nothing happens for a few months. It's a journey. It took a long time to get to where we are. And it takes a long time to get out. Yeah.
No, I agree. Definitely it's a journey. And yeah, when you say foundation, it could be any of so many things. That is really the thing, right? And often people think, oh, it's just, I'll naturally remove this with that. And it doesn't work that way. There may be a so-called wrong way of thinking, or some self-sabotaging patterns that if you don't address those, you're in the same circle. So, very, very good point. And I think that for our profession, that's something that really needs to be clarified. We're not just using natural things in the same dogma and belief system as allopathic medicine. We need to go way beyond that. So I'm really thrilled to hear this.
There are 2 things I think our listeners would appreciate. One of them is the quality of relationship and communication that we have with our patients. And this has been called high touch. But however, this has evolved. It took me most of my practice to realize that to stop acting like a doctor, meaning and having the contact with my patients that a doctor has, and be true to what I needed to know about my patients and what I needed to communicate to them to get well, because this is not medicine. This is the work of self-healing. Mm-hmm. And so Node and I, there's patients that we're texting them several times a day, because that needs to be so. We need that information, right? They need that information. And so we have this level of connection with our patients. And then that's a level of support that, as well as I don't know anybody else that comes anywhere near doing this, because they don't do the same work as we do. Right. And then after seeing us, after going through their intensive, we offer them an affordable means of continuing support by entering into our program of Nourish, where we have given them, they're trained, we've given them instructions on what they need to focus on for the next month or a period of time till they come back and see us again. Then they're in an organization with like-minded people that they can be in triads with and hold one another accountable, but they also have access to other doctors whose patients are there, who specialize in pain and trauma and other things. And we have regular meetings with them. We would have you come in and offer a class. There is this community of self-healing that we call Nourish that allows them to maintain that in an affordable fashion.
Wow. Thank you. This has been so inspiring, and thank you so much for both taking time out of your day to share this.
Thank you.
Yeah, thank you, Manon.
Bye.
Thank you for joining us at the Healers Café with Dr. Manon. For more information, go to drmanonbolliger.com.